Thank you everyone for coming. My name is Carolyn Martin, and I am the Outreach and Education Coordinator for the network of the National Library of Medicine in Region 5. My pronouns are she and they, and I am the host of today's session of the PNC-MLA Health Equity and Diversity Speaker Series. And with me today, you've heard Maddie, is Maddie Romancic, my colleague here at Region 5, who is taking care of some of the technical aspects of the session, and Carol Ann Curry, who will be monitoring the chat. This series is a collaboration between the network of the National Library of Medicine Region 5 and the Pacific Northwest chapter of the Medical Library Association. Many people in our communities have or are currently experiencing homelessness. Maybe you have also had that lived experience, as has our guest speaker. Over 580,000 people were reported to be experiencing homelessness in the US, according to a point-in-time count and housing inventory count in January 2022. And according to the latest report from the National Alliance to End Homelessness, the top 10 states with the highest rate of homelessness include California, Oregon, Hawaii, Washington, Alaska, and Nevada, all of which are in NNLM Region 5. Our guest speaker will be focusing on homelessness and health, but before I introduce them, let me first go over a few details about this session. We have already muted everyone as they join the webinar, and we ask that you stay muted through the presentation, but you are welcome to put your questions and comments in the chat, and that is the little speech bubble that you see at the bottom of your screen. Please make sure to use it and have your comments going to everyone so that we can all see them. We also want to thank our live captioner who is here to provide that service. You can access the live captions by selecting closed caption, or if you don't see that, you can, and your screen is a little smaller, there are 3 dots that you can click on and then you can select captioning from there. For attending today's session, you can get a Medical Library Association CE credit. Please stay on the webinar, and at the end, we'll be providing that for you. And just make sure you check that out because we will not be emailing the evaluation link to attendees. So we just provide it here in the session. The session is also eligible for competencies for health education specialist or CHES. Just know that you will need your CHES ID to complete the evaluation. And the session is also eligible towards the Consumer Health Information Specialization, or CHIS, through MLA. But please keep in mind, we would appreciate you taking the evaluation, whether you want that CE or not. NNLM has a code of conduct, of which the primary content is on this slide. It is a reminder that we are all here together professionally, and we would want to be inclusive and respectful, and your cooperation is much appreciated. The code of conduct is also available on our website, and the link to that is in the chat. Josephine Ensign is a professor at the University of Washington, where she teaches public health, health policy, and health humanities, and has been a nurse for 40 years. Her scholarship and practice as a nurse practitioner focus on trauma-informed care and health inequities for people marginalized by poverty and homelessness. She has written extensively on the topic of homelessness, including a book scheduled to be published in 2024 titled Way Home, Ways Out of Homelessness. We're very excited to have you here today, Josephine, and I'm going to go ahead and let you take over, and I will stop sharing my screen and let you share yours.
Okay, welcome everybody, and I want to thank Carolyn, Maddie, and Carol Ann for facilitating all of this, the invitation, and for being here. And thanks everyone for putting where they're from as well. That kind of helps me know, which I think is great, that there's definitely across the country spread of people. So I'm going to share my screen, and can you see it okay? Yes. Everybody, thumbs up?
Yes.
Okay, thanks. All right, thanks. Yes, so thanks for the introduction as well. And I do want to emphasize For this presentation that I do have the lived experience of homelessness, it was a long time ago when I was a young adult, and it was in my hometown of Richmond, Virginia. However, if anybody has on this call has experienced homelessness or has a friend, relative who has experienced homelessness, the experience of it is what a lot of times people say is scarring. It is traumatic enough, whatever the different causes and what happens during homelessness, as well as what happens, hopefully, for people being able to extricate themselves from homelessness. But it leaves its mark, and that has really been a factor in terms of my own practice as a nurse practitioner. I'm a family nurse practitioner, still working with people experiencing homelessness here in Seattle, and it also affects my scholarship. So this is the plan for today. I just wanted to kind of start out with that, talk about homelessness, health needs and concerns. I want to weave in a few case studies or examples from my own work and some that are very current just in the past month or so. And then hopefully all of us in terms of sharing resources and best practices. This, for those of you who aren't from Seattle, this is a photograph. Seattle is in King County. A photograph in the background is our region's main trauma center, Harborview Medical Center. You can see the tower through the trees, and 10 encampments in front of or beside the off-ramp to I-5. And we do have one of the highest rates, especially of unsheltered homelessness in Seattle and King County still. So I want to start off with homelessness definitions. I will use homelessness a fair amount. I acknowledge that a lot of people, a lot of advocates, prefer the use of the term houselessness to really put an emphasis, for good reason, on the fact that that housing, lack of affordable, safe, long-term supportive housing is a main factor in homelessness for people. And also, of course, people first language, which I do try to weave into it. People experiencing homelessness or houselessness. I will say that I have a preference myself for still using homelessness, and people who I work with, and a lot of times don't call themselves, we don't go around with a label saying I'm homeless. It's very stigmatizing. And I do work with a fair number of people who are vehicle residents, for instance, living in their cars, trucks, vans, and RVs. And people, especially living in RVs, they do consider that their home. So they will call themselves a lot of times houseless and not homeless. But I just wanted to kind of put that out there to explain some of the different definitions. This is the official definition of homeless from the Department of Housing Urban Development, and the usual individual family lacks a fixed, regular, adequate nighttime residence. Also includes unaccompanied youth under 25 years of age, and then individuals or families who are fleeing or attempting to flee domestic violence, intimate partner violence, and have no other residence. And being a family nurse practitioner, I've worked across, and I still work across the lifespan. I do have a special heart for homeless teens and young adults. I have done a lot of work with that population, kind of on both coasts of the US as well as internationally in Thailand and Venezuela. So health and homelessness is to remember that poor health and trauma can contribute to homelessness, can be kind of predisposing vulnerabilities, and that homelessness or houselessness complicates healthcare treatment and the recovery process. And I'll talk a little bit more about like why that is and the role of libraries in helping with that. Poor health and trauma also prolong homelessness and contribute to what is termed chronic homelessness, people who have been homeless episodically over years, and who also have accompanying behavioral health and also physical health issues, as well as disabilities. So I like the term social exclusion. I was lucky enough to have a Fulbright, US-UK Fulbright in 2018, 2019, before the pandemic struck, based in Edinburgh, and did a lot of work with charities there, NGOs, and direct service providers and researchers working on homelessness and social exclusion. It's a term that's beginning to catch on more here in the US, but it's a term and concept which really has grown out of work in the UK and European Union. Refers to individuals, groups, communities who are stigmatized and have many kind of intersectionalities, race, different identities, as well as disabilities and other kinds of things. So this includes people who are homeless, houseless, migrants, refugees, sex workers, people prostituted, especially teens that are prostituted, Roma, they still use that term in the UK. Here, we don't use that quite so much. Travelers and incarcerated people with mental illness or substance use disorders. So people who have very common and oftentimes overlapping vulnerabilities and social exclusions. And the UN definition, just to emphasize, and again, kind of pulling in the important role of libraries, whether they're medical libraries or public libraries or school libraries, whatever libraries, that in terms of access to information and services, that really can help in terms of addressing and improving social inclusion for everyone. So some of the dimensions, again, coming from a UN perspective of social inclusion, economic participation, health access to services, personal independence, education, interacting with society, and fulfilling social roles. So again, those of you, you know this better than I do, since I'm a nurse and not a librarian. I think if I come back in another life, I would love to be a librarian. But all of these, the role of libraries in terms of economic participation, being able to access, for instance, through public libraries, information on jobs, and then also information on health and their own health, how to access health. And this is where, especially in terms of health literacy, of helping people, people across wherever they live, whatever age they are, of understanding how to really find reputable health information. We saw during the pandemic, especially how this the misinformation and the spread of misinformation with social media, et cetera, really hindered and actually killed people, and helping people know about Medline Plus, for instance, and access that. Independence, being able to find whatever information they need, even if they're teens, access to education. And then also within the public sphere of libraries, of being able to hopefully interact with across different elements of society, and in a positive way, and fulfilling social roles. By the way, what I wanted to say, if you have a burning question, like something that maybe I misspoke or you didn't understand, to put that in the chat, so some of the people facilitating can interrupt me, so I can address that. Otherwise, I'm going to give ample time after the presentation for discussion and questions. So from a health perspective, socially excluded populations have a mortality rate that's 8 times higher than the average for men, And for women, the mortality rate is 12 times higher. And this one's from a Lancet article in 2018. And again, that includes homeless individuals, prisoners, sex workers, and people with behavioral health issues, including substance use disorders. And so something that has been growing, and again, especially in the UK, when I was there, I worked with a great NGO that works with the NHS, the National Health Service. It's called Pathway for Health, and they focus on inclusion health. And its research service policy agenda that is really aiming to prevent and redress the health and social inequities among people who are socially excluded and have multi morbidities. And there are different best practices, approaches, and many of them are translatable across cultures, across countries, that we can definitely learn from what other countries are doing. We all know that our country spends the most per capita on health care, on medical care, and yet we have among the worst health outcomes, including, maternal morbidity, infant mortality, and overall lifespan, which is decreasing across the board in our country. So something is not working. Looking at other countries to see what kinds of things can help. So this one, it came out in 2022, can update it. It's gotten even worse, but this one I think is a pretty amazing chart of looking at deaths of people who are homeless in the US, across 20 US jurisdictions from 2016 to 2020. So of course this only began to scratch the surface of excess mortality from the COVID-19 pandemic, of course, deaths from COVID itself, but then also the toll that the pandemic took on our healthcare system and access to care, even for things like heart attacks and excess morbidity for people, as well as what's called, you probably have all heard the term deaths from despair. People who work in healthcare for the homeless here in our country talk about deaths from profound despair for people who are homeless. So just layers upon layers, not only from the living situation, especially in the pandemic, crowded shelters. We already knew before the pandemic, tuberculosis and other kinds of infectious disease, they're not a healthy place for people to stay. They're often noisy and can re-traumatize people. So traumatic experiences, it's not just like a bad hair day, because it's misuse, especially kind of in social media stuff, but it's an event that involves actual or threatened death or severe injury, includes sexual violence, learning about these from close family member or friends, and repeated or extreme exposure to details of the events, vicarious trauma. And so this is something that, again, people who experience homelessness, wherever they're at on the age, gender spectrum, oftentimes come from, especially childhoods of pretty severe traumas that they've not been able to receive adequate help with dealing with them or overcoming them. This is especially the case with homeless teens and young adults. And so those of us in helping professions, which include librarians, of understanding that not only for people who are homeless, but people, again, kind of socially excluded populations, people in active substance use or with mental illness, and understanding what that does to the person in terms of brain function, developmental, as well as behaviors. Complex trauma, it's where it's repeated, prolonged. It's often interpersonal, like from a primary caregiver. And at developmentally vulnerable times, childhood, adolescence, severe illness and disability, and old age. And one thing I'll just point out here is the increase in people who are elders, who are homeless oftentimes for the very first time. This happened a lot, again, accelerated with the pandemic, with housing instability. And so people are dealing with this in our country across the board. And of course, also with the baby boomers. So in terms of trauma-informed care, of understanding its trauma impact, so if you haven't already, there's some really excellent trainings on trauma-informed care. This can really be helpful wherever you work within a library kind of a system, promoting safety for everybody in the library, including library staff, cultural humility, and supporting consumer control, choice, autonomy, learning some aspects of what's called motivational interviewing, which is a way of diffusing situations, of finding out where that person's at, what it is that they're really wanting to have done, and trying within what's reasonable for that situation, that space, of trying to meet those needs. And also, when we work with people who are homeless, we always support, or who've had severe traumas, of supporting hope, or populations that have been especially traumatized, that recovery is possible. And then also supporting each other in different settings, including libraries, to prevent burnout. So this, again, I won't belabor it. I will go to the last two on this. So again, the significant trauma before and during homelessness really can complicate health, social support services, and education. The stress levels, we all know, stress, just kind of puts us, puts us, in terms of Maslow's hierarchy of needs, we're just really kind of looking at basic needs and survival. So, in terms of knowing where to access healthcare, health information, social support services, much less education, can really kind of be pushed to the side, even though they're very important. And also of looking at the role of historical trauma, and that's for populations in our country, African Americans, in terms of the whole despicable legacy of slavery and racism kind of built within our structures and society. For people, indigenous populations in our country, as well as Jewish populations with the Holocaust and continued bias and hate crimes. The other one is sanctuary trauma, so that even with our best efforts to try to provide like a safe place for people, whether it's in a library, whether it's in a shelter setting, that some of what we build into that can actually be inadvertently re-traumatizing. So again, especially in crowded shelters, the noise level, the crowding, people having dramas of their own can really be re-traumatizing. And that's why a lot of times people who are experiencing homelessness, who might be now back in a crowded shelter situation or a crowded tent encampment or a vehicle residency encampment, will seek out quiet places. And I've had people who have told me who have been significantly homeless, like chronically homeless, have not only survived that, have gotten out and are thriving, that one of the main things that's missing, and that's essential for somebody who's trying to survive homelessness, is a quiet, safe space. And so they talk a lot about libraries, of being able to provide that. And we'll go through this a whole lot, but again, kind of adapting it this is for healthcare services, but for libraries, of just, again, not assuming certain things about somebody who comes in, who looks homeless, or who is asking for help finding services, for living rough, or living outside. And remember that people have all sorts of different backgrounds and situations and even educational levels. I recently worked with a 50-year-old woman from India who's lived in our country for the past 20 years. This was in a women's shelter and with a medical clinic that I work at here in the University District of Seattle. And she has Kalman syndrome, which is hypogonadic gonadotropic hypogonadism. That's a mouthful. And hers is specifically the X-linked recessive one, genetic change, and it causes, for her, has caused a lack of puberty and also a sense of smell. And she was very well educated in India, in her home country. Was looking for a job, and she also was really asking us how she could get more information on her syndrome and finding healthcare providers in Seattle, where she plans to live long term, who could help her with that as she's now starting to be middle-aged, and so. She was already planning to go to our main library, downtown public library, and work with librarians there. And I also let her know about the University of Washington Health Sciences Library, which is not as accessible now to the public as it was before the pandemic, but of how she could get librarians to help her with that. So the role of libraries, I mentioned safety and quiet. Libraries always have a safety plan at large urban libraries like ours in Seattle, the main library, which if you ever come to Seattle, you must visit because it's an amazing building structure as well as what's going on inside of it and the resources. Of course, there's always the controversy about sleeping in a library. I know the last time I was in our University of Washington Health Sciences Library, there were prominent signs saying don't sleep, which I thought was kind of funny because I remember being a nursing student and also an undergraduate student and studying in libraries and falling asleep. So I know that there's like different ways of dealing with that, and the fact that people who are experiencing homelessness, a lot of times, they're having to walk around all night, they're tired, the lack of being able to sleep. So how to do that in a way that's not interfering with the other patrons of the libraries. And again, like basic needs, access to bathrooms, being out of the elements, being, if they're air conditioned. A lot of our libraries in Seattle, for instance, are not air conditioned, because we used to, before climate change, we used to have not very hot summers. That's changed, unfortunately. But a lot of times access to heat in the winter and air conditioning in the summer. Information, resources, enjoyment, because the other thing is that people tell me, and that I experienced when I was homeless, is that especially chronic homelessness, that it can be really boring when it's not terrifying. And so being able to, look at comics or whatever it is, read, different kinds of books, magazines, and a sense of community and belonging. So this, I just want to mention to kind of screen grabs, and I'm sure a lot of you across the country, I know especially those in states like California that have high rates of homelessness, is a lot of times libraries are hiring social workers who understand the different social services, not just for people who are experiencing homelessness, houselessness, but also domestic violence, medical health, job training, and then how to help people sign up for the free Wi-Fi hotspots and books to those living in encampments. So that's from the Seattle Public Library. And then on the right-hand side, that is a photograph of me my setup. I was working in the main library in Auckland, New Zealand. And the insight into the experience of rough sleeping in central Auckland. A lot of different city government entities, and including the library system, got together to do a very large study, not just qualitatively, but also quantitatively, to look at what was going on. And rough sleeping, if you don't know that, that's a common term in the UK and other kind of UK, former colonies for sleeping outside, for being homeless. And this kind of side by side shows like some of what they came up with the report. And just to show, like, the blue ones are people from the general public, including like library patrons who they interviewed, versus people who were experiencing homelessness and who were rough sleeping. So, like around the toilets, pointing out people who are living rough, that access to toilets or showers are really, really difficult and limited. And then patrons from the public saying, they stink. Sometimes I have to clean up their feces and urine, which I know also happens with librarians or library staff. And then some other ones in terms of, again, sleeping. From a patron, I get annoyed when they sleep on the park bench where I want to eat my lunch, or in the library. And then from a homeless patron, I walk around at night and sleep in the day when it's safer. Okay, and these are some resources. We're kind of coming to the end because I want time for questions and discussion and sharing other resources that you all may have. These are some good, more recent books on homelessness and libraries. And the one on the right, The Librarian's Guide to Homelessness, by Ryan Dowd. He is a long-term homeless service provider, I think in the Chicago area. So that has from a person who's very steeped and experienced in homelessness. The one by Julianne Winkelstein, hopefully I'm pronouncing it right, Libraries and Homelessness, that's a very recent one, and that's written more from the librarian's perspective, and an action guide with some really good case studies and kind of best practices. So those are two that I like, and there probably are others that you might know about. So these I won't go into a lot, but just evidence-based interventions and education, housing first, and that's permanent supportive housing with supportive services, behavioral health services. This is a photograph of the 1811 building in downtown Seattle, which is one of our country's longest standing, what they call wet house, harm reduction for chronic inebriates, and has shown to be very cost effective, but is controversial. A lot of backlash, especially from more right-wing politicians at this point. It was never meant to be a panacea, a cure for homelessness, especially for chronic homelessness. It definitely is evidence-based. And these I'll just call out, I'm not going to show them to you in the interest of time, but the NHS pathway video at the top, which is called Less, is really excellent. It's 12 minutes. It just came out this spring, late spring, and it's people who are living rough in the UK talking about their difficulties accessing healthcare. So it can help you kind of see that. And a lot of them are very, very similar to what people here in our country deal with. Of course, we do not have an NHS, even though I know NHS is going through difficulties, but at least they have it. Another one, this is not a video, it's a great article. It came out in Slate in February of this year, State of Mind, Denise's Last Days. And it's talking about the problem in terms of people with end of life, terminal illness or end of life for whatever reasons, who are homeless, and the lack of services for them. And then this last one, I'll see if I can just show it to you real quickly. And we'll end on that. This, I worked with people from Story Center in Berkeley this spring through ArcGIS story maps. And this is a site, it's all free, you can look at it if you want to. That's an interactive map of King County, obviously focusing on what's happened here in King County over the history and currently, and the interaction with healthcare as well, and getting into some contemporary kinds of things from more rural areas of King County. So that's what I will end with. I have some other resources at the end. I know you all have, I think you have access to the PowerPoint slide deck, hopefully, right?
Josephine, for your last your map that you showed, you're still in the PowerPoint view, so the attendees weren't able to see the map.
Oh dear.
Does that make sense? Okay.
Right. Yeah, so why don't we go to questions and I'll try to pull that up and show it to people.
Okay.
How's that?
Thank you, Josephine. I'm sure our audience has some questions, but first, let me ask Carol Ann to go ahead and put the link to the evaluation in the chat box. We have both a long link and a shorter link because I know some of your institutions have limitations on some of those kinds of links. So just to let you know that we'll put that in because I know some of you may have to leave earlier. And I want to make sure you have that. And again, you don't have to be a member of the Medical Library Association to get that certificate showing that you've attended. And it's still eligible for the Consumer Health Information Specialization as well as for CHESS. And there are instructions when you answer a question about whether you want the CE credits or not, and just follow those closely. And if you have any questions, you can always contact us. And we also have, I think, an email link that we need to put in there. Yeah, in case you have any questions about accessing that as well. Josephine, I'll go ahead and let you answer some questions. One of the first ones we had, it was that people had asked about whether they have access to your PowerPoint. And did you say you, we don't usually provide that for people, but we ask if they can contact you maybe directly?
Sure.
To send those, because we feel like that is kind of your decision, our presenter's decision to share those or not.
Right. No, and I mean, getting the information out,
Okay.
I'd be fine to give my permission to you all to share it to people, or people can also contact me if you want to.
And what is your email? Just to.
It's sorry, it was at the very front of the first slide. Okay. It's B, as my first name's really Barbara, BJ Ensign, ENSIGN at UW.edu.
Thank you.
And I shared the link to the ArcGIS story map in the chat, but I'll also try to share it with you now. Can people see it now? Yes, no?
Yes,
I can see it.
Okay, yeah. So that's what it is. It's free. It's on their story maps one. So you can just type in Skid Row stories of homelessness in Seattle. And this is based on now decades of research that I've done, not just historical research, but also I now have a series of over 60 oral history interviews with people working and living and have a lived experience of homelessness in Seattle and King County. But it includes the story of like our first official homeless person in Seattle, and it's a growing collection. Okay, are there questions? Comments? Other people have like other resources that they particularly like, or things that you're doing in your libraries, wherever you are? Either you can type it in chat or raise your hand, I guess.
We did have someone asking, are there any websites or sources you can recommend for stats or data? Examples like the US Census Bureau, healthinformation.gov, etc., related to health disparities or houselessness or
Oh,
homelessness?
right. Well, for health disparities, for health inequities, the center, CDC has some really good up-to-date information. For homelessness specifically, I mean, it's an advocacy group, but the National Alliance to End Homelessness is good. But from a health perspective, health and homelessness, I'm on the policy committee. I've worked with them for many, many decades, is the National Healthcare for the Homeless Clinicians Network. And they have some excellent free trainings, including on trauma-informed care. It's geared towards kind of like, health professionals, but at all levels, including like outreach workers. So a lot of it would be pertinent, I think, to many of you who work in libraries, and they're excellent. They just updated their Homelessness 101. I just got a message from them yesterday. Again, that's free. They offer continuing education kinds of things, and it does include like up-to-date statistics from across the country on homelessness.
We also had somebody who said, are public and local libraries training their staff and helping to work with those who come in to seek help? And I know you've mentioned the 2 books, and I know Ryan Dowd had offered different trainings through various library organizations, but I don't know if there are others out there that you might know about.
I don't. I was hoping people would inform me today, because it's long been a fascinating interface for me. I worked with the UW, University of Washington Health Sciences Library back probably about 15, maybe 20 years ago now, with one of their grants to get computers installed at one of our main homeless youth shelters, and then also training and gearing towards health literacy and helping young people understand how to like critically appraise health information and prominently promoting Medline Plus. That was really effective. I loved doing that. I worked with the the teen librarian at the main library downtown in terms of having more kind of health information and resources. But other than that, I don't know what is going on across the country.
And I would maybe add with that, if any of you who are attending know of any such training, please feel free to put that in the chat and share it.
Yeah, Mary Jane from Portland put in streetbooks.org.
And Andrea Hara was asking, kind of somewhat related to that, do we reach out to our public librarian teams in the health and sciences departments? Do we reach out to our public library teams in the health and sciences departments? Andrea, I'm not quite sure if I understand your question. Are you asking if health science libraries should reach out to public libraries who may have more experience in this area?
We could unmute her if she would like to.
Andrea, would you like to be unmuted to clarify? I'm sorry, I can't see.
Sure. Can you hear me now?
Yes.
Hi. Yeah, I'm just wondering, I presume the National Networks of Libraries of Medicine does do outreach specifically to the health and sciences librarians in the public libraries. But I also wonder if anyone who's part of a medical library has developed that relationship. It's something I'm considering, and I also like the idea of reaching out to the teen librarian. Many times if you go through the help desk, they just want to know what's your reference question. So I guess it's couching it as a good reference collection rather than say reference question, rather than just saying, hey, do you ever, have patrons that need their information needs are more specific, and you ever need to collaborate with a medical librarian. I don't know if that need is there or if they feel like they can pretty much handle it with the resources they have.
Well, I can say from the kind of case study, the example from the Indian American woman who I worked with recently, I was encouraging her because she's, is very, very savvy in terms of that. She already had a connection down at the main Seattle Public Library, and I was encouraging her to ask specifically if there could be a link to like University of Washington Health Sciences Library, if that librarian at the public library could help facilitate that link for kind of more in-depth information. The research part of it, obviously not so much the how could she find a savvy healthcare provider who was knowledgeable about this syndrome.
Am I still on?
Yes.
Oh, okay. Yeah, so that gets into like patient referrals. So gosh, that's a great question. And I wonder about that myself. I don't think that's within our scope that we're to be referring to physicians, although there might be, like, say, in the case in the patient you brought up, if there's like an endocrinology clinic, or if there's, I mean, obviously there are patient referral. If you call any hospital, they will refer you to the department that can help the patient. And then otherwise it would be, I would think, a chat, some kind of librarian chat group or homeless, advocacy chat group that is aware of the physicians and, who could help patients with particular problems.
Yeah, and I would say also, because our healthcare system is so overwhelming, even for those of us who have jobs and good health insurance, we know that. And so in remembering for people, with additional barriers like homelessness, it's even more overwhelming. The other one I would suggest is in your area, and they're across the country, healthcare for the homeless agencies and clinics, because then they specialize in that access to health care, including specialized health care for people who are experiencing or who have recently experienced homelessness. So that could also be a really good resource for librarians to know about in their area.
Yeah, definitely. And I also put in the chat, we have a street medicine program, so I would probably refer them to one of those faculty and see, what they suggest as well.
Right. Yeah, and just to remember that, vast majority of people experiencing homelessness, in terms of access to healthcare, they need help with access to basic primary healthcare in the overwhelming majority of cases. And so that's, in terms of finding out within your area how to do that. Again, the social workers that are assigned to public libraries, like at the downtown Seattle one, they would know, they would have access to a lot of those resources, I would imagine. I now plan to interview the person who's in charge of it here to find out more.
Yeah, I didn't know that was a thing, so I'm gonna explore that as well. A social worker assigned to a library, a public library.
Yeah, and they keep up to date. I think what my understanding is, especially like the one in Seattle, is they also help trainings in terms of library staff and best practices in terms of being welcoming and everything else within reason in terms of people across all walks of life, including people experiencing homelessness, but then they also really have access to all of the different social services that people need, not only if they're homeless, but they're new to town, or they're, trying to get out of a really difficult relationship, things like that, they can help with in our area.
We had another person asking, do you have any thoughts about the relationship between the social determinants of health and homelessness?
Well, yes, I do. I teach a whole class on that. So no, I won't give you that whole class. But I mean, that is the social determinants of health and the social determinants of health equity, which takes it a step further in terms of that not everybody has equal access to all of these basic determinants of health is a huge factor in terms of homelessness. And so again, like overlapping kinds of intersectionalities and overlapping strengths, as well as challenges that people face, is an important thing to understand within the patrons that you deal with.
We had a question come in kind of early on during the presentation from Alyssa Willis. The question is there a most common cause of death? For example, exposure to the elements, the drug use related deaths?
That's a great question. So it depends on when and where, right? I know, as I'm most up to date, obviously, on where I am currently living and working in Seattle and King County. And I think, across the country, we've seen this, started during the pandemic, has really taken off, is deaths from meth and fentanyl use among people. I mean, everybody, even housed teens, but especially in our population who, for instance, are living unsheltered in Seattle and King County, that is if not now the leading cause of death. Also suicides, those increased a lot. And again, different kind of demographics for that, but that increased during the pandemic and has continued to be a problem, not just in teens, but in other ones as well. And then just, basic like morbidity kinds of things that we all deal with as we age, heart disease, myocardial infarction, strokes, cancers, diabetes, but how much, in terms of like how much worse those are in terms of all the risk factors that go into that, including stress, the stress of living homeless, and not getting access to healthcare, not having access to a place to, access to insulin, for instance, and then past that, access to a place to safely store insulin and the needles and the glucometer and all of those things. So that has always been, those kind of factors together have always been leading causes of death. But for homeless teens and young adults, it's drug overdoses and suicides are the leading causes. And then, also in our area, people living homeless during the winter, fires that happen, really serious fires, like intense, and they have filled up a lot of the burn unit at Harborview Medical Center. We have a really major burn unit here. And then in terms of if they survive of the long-term disability and follow-up care that they need is a huge issue. So exposure to the elements, yes, frostbite and heat exhaustion now, as we're dealing with, across our country, unfortunately, and will be increasing as climate change is really hitting us. And And then, accidents and violence, exposure to violence if they're living, especially if they're living outside. But that, again, if you want a really excellent and up-to-date kind of overview of that with statistics that's more national, I would steer you towards the National Healthcare for the Homeless Clinicians Network. It's all free, available to anybody. And their health and homelessness 101 training is really great. But also, if any of you, I'm trying to keep track of the really great resources that people are putting in chat. And if you have other ones that you want to send to me afterwards, I am hoping to kind of collate those and not giving attribution to anybody, because I know it needs to be anonymous, but of sharing that on my website for people to have.
I see, and I apologize, that our survey is going to the wrong webinar, at least for the chess part, and I am inquiring about that, and my apologies for that. And we will send out the correct link. If you could please email me at martinc4@uw.edu, and I'll make sure that you get that correct link. Let's see, is there anything else? Caroline, did you see anything else in here that from the chat? I know we have an admirer for your work.
No,
Yes. And I don't know if you realize we have someone who's an attendee who has also written a book that was one of the resources you recommended.
Oh, yay.
Julia
Oh, yeah.
Winklestein.
Did I pronounce your name right? Sorry if I messed it up. Yay. No, I really like your book. Thank you.
That's great.
Very practical and up to date. I'm not a librarian, but I really liked it as somebody who works with in terms of homelessness.
I'm just putting my email again in the chat just in case you received the wrong access to the chess credits, and you can contact me. We are at the end of our hour here. I appreciate everyone attending. I just wanted to mention that we don't have another session yet scheduled for the PNC-MLA Health Equity and Diversity Speaker Series, but I think Carolyn will put something in the chat that is to our class catalog. And if you scroll down at the bottom, there is a link to both the upcoming and the past sessions where the recordings are. And you can check that to see for future sessions. We hope to have one this fall, but at this point, we don't have all the details ready. Thank you again, Josephine.
Yeah, and I just want to thank
that.
everybody for their work that they're doing. It's excellent. Thank you.
And thank you all as attendees for sharing your experience and your information and your questions. And I hope you were able to also gain something from this as well. We really, really appreciate it. And thank you again, Josephine. And we hope you all have a great rest of the day. And if you have any questions about the evaluation, please don't hesitate to contact me. Thank you.